Now we are done with the various positioning used in nursing. Today we are going to be discussing the guidelines for proper positioning. What you should take note of when positioning your patients. Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for students. Today, we're going to be giving you the various guidelines when you want to position your patient, how you should do, what you should take note of. It's not just going to the patient and like, I want to tell my patient without having no guidelines, no rules backing you up. But before we go into details in today's class, if you are new on our YouTube channel, you are a first-time viewer, please click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier told you, today we are going to be giving you the various guidelines that you should put at the back of your mind when you want to position your patient. The first guideline you should take note of is explain procedure to the patient. Remember, in nursing, before you even take a patient's vital sign, before you do anything to your patient, you have to seek consent, then what? Explain the procedure. Tell the patient, madam, I'm going to be placing you in a supine position. You are going to lie flat. I'm going to put a pillow under your head. You have to explain that procedure to your patient. If you don't explain that procedure to the patient, I as a patient, I can sue you. Yes. So remember, explain the procedure to the patient and seek proper consent. Then the next thing I have to tell with you is that get the patient to assist. Yes, you have to assess your patient first. Oh, is my patient unconscious? Is my patient able to move? Is my patient sleeping? Is my patient stagnant? You have to assess the condition of your patient first. Then you get the patient to assist. Oh, madam, as I'm raising you up, you put your hand on my shoulder, things like that. Get the patient to assist as much as they can, but not allow them to pass their assess. Then the third one I have here is get adequate help. Yes, you have to get adequate help. Sometimes positioning is not just a one nurse procedure, it's usually a two nurses procedure depending on the type of position you are about to place that patient in, and also depending on the condition of the patient. So it's better for you to get adequate help. It might be from the caregiver, it might also be from a colleague to help you put this patient in the right position. Then the other key points I have to share with you is that raise the bed to your height. You cannot be tall and the bed is very low. Raise the bed to the height that you know, oh, when I raise it to this height, I will be able to attend to my patient properly. That is why you have that thing that used to raise the patient's bed. So raise the patient's bed to the height that you know is going to be comfortable for you when positioning this patient or changing the patient's position. The other point I have to share with you is frequent position change. Yes, especially for patients that are unconscious, that are unable to move about. So you have to frequently change their position and also provide comfort. Most times when an unconscious patient is lying about, they tell you to treat pressure areas, always change the patient's position to avoid pressure sore. You don't want your patient to develop grade 1, grade 2, grade 3, grade 4 pressure sore ulcer. It's going to be a bad nursing management and it's going to be a bad name for that nurse on duty. So it's important to change your patient's position frequently. And also you can use mechanical aids. There are some mechanical aids that helps to change your position properly. You can have your slings, you can have your bed board, you can have your footboard. All these mechanical aids help you to change your patient's position properly. Then the next point I have to share with you is avoid friction and shearing. You don't just drag your patient, rather it's advisable you lift them. You lift them to avoid friction and to avoid what? And to avoid shearing. Something I want us to take note of is the proper body mechanism, and I'm going to be sharing them with you. In terms of the proper body mechanisms, observe good body mechanisms for you and your patient's safety. For you and your patient's safety, you have to observe what? You have to observe good body mechanics. The first one I have is position self close to the client. You don't have to be far away from your patient when positioning your patient. You have to position client close to yourself when changing position. Then the other one is avoid twisting your back, neck and pelvis by keeping them aligned. Avoid twisting your back, neck and pelvis by keeping them aligned. Then the next point I have to share with us when it comes to body mechanics is flex your knee and keep feet wide apart. Do that right now. Flex that knees. Keep your feet wide apart. Use your arms and legs and not your back. When positioning, you are expected to use your hands and your legs and not your back. Then the other point I have is tighten abdominal muscles and gluteal muscles in preparation to move. See, tighten the abdominal muscles, tighten the gluteal muscles in preparation for you to move. That is a very important point you should take notes of. Then the other point I have here, the last one, person with the heaviest load coordinates effort of the nurse and initiates the count to 3. After you finish tightening both the gluteal and the abdominal muscles, the person with the highest weight, the person holding the part that is more heavy, should count 1, 2, 3, then we lift. I don't know if you get. So there's going to be some counting. So these are the guidelines you have to take note of when it comes to proper positioning of your patient, because proper positioning of your patient ensures that the patient is comfortable. Proper positioning of the patient ensures that your patient's dignity is maintained, and also proper positioning of the patient allows for proper exposure and visualization of the parts needed for surgery or for the collection of a particular specimen. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to subscribe, and don't forget to share with a friend if you got value. If you are a student nurse watching our video and you have not registered for our Telegram class, I bet you have been missing a lot. There is more than a lot to learn from our Telegram classes. You have access to all our voice notes that explains the various systems in nursing: cardiovascular, respiratory, digestive. These also explain the anatomy and physiology, the medical surgical nursing. All these in our Telegram class. You also have access to research, community health management in our Telegram class. Thank you very much and see you in class. Bye.